Okay, so question is here. The nurse has just assist a client back to bed after a fall. So the nurse and healthcare provider have the assist the client and have determined that the client is not injured. After complaining the incident's report, the nurse should implement which action next, right? Reassess the client, conduct the staff meeting to describe the fall, also documenting the nursing note that the incident's report was completed. Document the incident nursing note and also contact the nursing supervisor to update the information regarding the fall, right? Reassess the client. It is very important. And contact the staff meeting. I think at least you can say this is not an answer. Document the nursing note that incident report was completed. Is also less. May you are confused out of 1 or 3. Okay, so already student answered. The answer is 1, right? So definitely you right. So I said when you go through the 4, is it to exclude or just out which is not an answer? Like number 2 and 3, no way. Maybe you are confused number 1 and number 4. So number 1, they call reassess the client, and here contact the nursing supervisor to update the information regarding the fall. But when a patient is fall, you has to check, you has to help them to reposition comfortable position, and you found there are no sign and symptom of injuries, and you wrote the incidents report. Definitely after few minutes you have to reassess the patient, because some of this problem is arise after few minutes, some of the complication, especially the elder patient, right? So what is new we learn, we have to keep a note. You write your answer is 1, and then go for the second question from here. What they said. So here the nurse is caring for a client with a heart fail. Patient is the heart fail. On the assessment, the nurse note that the client is dyspneic or crackles on audible on the auscultation, right? So first of all, the patient has a history of heart fail. This is the key point. On your assessment, you found the client is a crackles, added heart sound, audible. Maybe patient has all have affected the lungs because of the congestion. What additional manifestation would the nurse expect to note in this client if excess fluid volume is present? So I said when heart is failed, heart does not work. So heart pumping ability fall. So you know the blood is going to left ventricle from the lungs, right? But if my left ventricle does not expel the blood, or if the left ventricle does not contract very well, that times blood should be accumulate in my left ventricle, again accumulate, and so blood has a regurgitation. So from left ventricle, blood supposed to go forwarding. I mean, arch of aorta and distribute to the body. But if heart is failed, blood supposed to go back the lungs. Means lungs will be full of the fluid or blood. This is called congestion of the lungs. When congestion of the lungs, if you put the stethoscope over the lungs, you can get some added sound like crackles. So means your patient lungs is get involved, right? So you can see the other signs and symptoms related to the lungs or related to the your associated structure. So what are they said nurse expect to note which the client if excess fluid volume or excess fluid volume. They said okay, would the nurse expect to note, right? Excess fluid volume is present. Fluid volume is present. They said weight loss and dry skin, fluid volume, excess, so weight loss. No, right? Weight should be increased, body weight. So this is less chance of this answer. Also, the flat neck or hand vein decrease the urine output, excess fluid. So less chance, right? So what is your answer already, student answer? Okay, so anybody answered this question? Or okay, what is your answer? Number 3. Okay, Sandra, answer number 3. And increase the blood pressure and also increase the okay, respiration, increase the blood pressure and increase the respiration, right? Everybody answering the 3 anyway. Weakness and decrease the central venous pressure, right? So the answer is 3. Everybody is correct, but I said you are thinking very, right way. You are in the right track because this fluid is volume excess, chance of develop edema. So there are no way weight loss. Weight should be increased. And flat neck or hand vein or decreased urine output. If my fluid is excess, maybe urine output will be increased. More food, more pee. Weakness and decrease the central venous pressure. I said if blood has a backflow and if left heart failure, they lead to the both side heart failure. So jugular venous pressure or central venous pressure must be increased, not a decrease. Only one option is there, increase, and all is decrease, 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 right? It is increase. Increase the blood pressure and increase the respiratory. This is the answer. Now we are learning something very interesting from this question. Let me show you. If you are with me, you can get it. Like, I do not know what is the answer. I'm give you some tips for NCLEX board. Like, I do not know this is the answer, but how I can make it. Try to get me, my friend. Out of the 4 answer, This is decrease, this is decrease, this is loss, means decrease. Only one option opposite all of three, where they mention increase, right? This is the answer. As I told you, maybe I do not know which one is the answer. It is possible some question is like this. That times you have to find out which three is the same type of information, common word. Which one is the just opposite of this? That should be the answer. So I said decrease here, loss also kind of decrease, but all of the opposite is only here increase. It is the answer. I'm talking about in or scenario if you do not know, right? Go next question here. The nurse is prepared to care for a client with a potassium deficit. When potassium deficit, we tell it is hypokalemia. When potassium increase called hyperkalemia. Potassium is very important for our heart. If potassium deficit or increase or hyperkalemia or hypokalemia, both case develop the arrhythmias, right? And arrhythmia, if not treated, they causes the heart failure basically, right? So, and patient die. So I said the nurse review the client record and determine that the client is at the risk for developing potassium deficit because of which, right? So here one is called sustained tissue damage, require the nasogastric suction, or take the history of Addison disease or uric acid level 9.4 ml per dl. So read the question again. The nurse is preparing care of the client with a potassium deficit. So client with the potassium deficit, the nurse reviewed the client record and determined that the client at the risk of develop potassium deficit because of which, so I mean what medical condition lead to develop the hypokalemia, right? So one, they said sustained tissue damage, when tissue breakdown, some of the electrolyte is came from intracellular to extracellular in the blood, requiring nasogastric suction. So in case of nasogastric suctioning, chance of the fluid loss. Okay, so one student say answer is the 3. So I said require the nasogastric suctioning. So what are the risks to develop the potassium deficit because of which condition? So when nasogastric suction means fluid loss and has a history of Addison disease. So Addison disease is a endocrine disorder, right? In Addison disease, okay, some students answers the 2. So Addison disease, most of things are going to down, except the two electrolyte, right? Addition is an endocrine disorder. Most of the electrolyte or sign symptom is down, and I said addition, D for down, right? Uric acid level is 9.4 ml. This is another one. So you said answer is the two, some of the student, okay? So because their logic is here, they said when patient is fluid loss like vomiting, diarrhea, electrolyte imbalance. So when nasogastric suctioning means type of the fluid loss, right? So in that case, the chance of hypokalemia developed. So when you, maybe your right is fine, but if you do not write, that is also excellent because we learn, right? So go in rationale. So normal serum potassium level 3.5 to 5.0, we must know. So if the potassium level less than 3.5, hypokalemia. If it's more than 5, hyperkalemia. So what are the normal range? 3.5 to 5 millimole per liter. Potassium deficit is known as hypokalemia, and potassium-rich gastrointestinal fluid are lost through the gastrointestinal suctioning. What you thought, and so your answer is the 2. And placing the client at the risk of hypokalemia, the client with the tissue damage or addition disease are the client with the hyperuremia at the risk of hyperkalemia. So when tissue breakdown, potassium go from intracellular to the extracellular and increase the blood level of potassium, tissue breakdown. Same thing in addition disease, addition, everything is going down except potassium. Addition disease is an endocrine disorder. In adult health, I will explain. So addition disease or Cushing syndrome, these two. In addition, everything is going down except potassium. Potassium go up. In the Cushing syndrome, CRU, everything is go up except potassium. Potassium is supposed to go down. It is the rules we have to remember. So the normal uric acid level for the female 2.7 to 7.3, and for the man 4 to 8.5. So it is, I like to request you, all of the normal lab values you has to write in same page and you has to read them, memorize them. Maybe a few weeks ago, I sent it to all of you. If you need again, I will send you again. All of the normal lab values we should know. And that's it up to the solving the question. And here